I'll let you click individually on what you want. So, welcome to Women's Inequalities Training, an introduction. And just quick apologies that Jeannie and Lydia are not able to join us today. So my name is Sarah Louise Minter. I work for Womankind, developing this training. The full training is 3 hours, and this is an introduction to hopefully get you interested and want to sign up to the full training, which has been hugely beneficial to a lot of social prescribers who have already undertaken it. I work at Womankind, and I was signed up for 1 year to develop and deliver, and we've just been extended for a year because of the popularity of the training, which is really good news. So today we're going to cover introductions, which we've just done, and then look at women's inequalities training, the background, key points and outline, and then have a little quiz about the diversity of Bristol. And then we're going to look at the Reflective Groups programme, which are the sessions that have come out from delivering women's inequalities training to participants. Participants in the feedback tell us what they'd like to know more about. And so we've developed more sessions. At the moment, we're delivering sessions on autism and self-injury. And we're going to be bringing in further sessions on Black and minoritized communities and mental health, and hopefully menopause and BDP, which I've forgotten what it is. And then we're going to look at Missing Link and Womankind and the services we offer. So why was this training developed? Last year in July, the Women's Health Strategy for England was published. And if you've not read of it or heard of it, I can recommend looking at it. It was a really comprehensive document. They consulted all sorts of groups throughout the country to look at what was needed to be done to improve outcomes for women within the health system. And as an outcome of that, various funders were asked to provide money to support the activities within the health strategy. No money was provided, but providers were asked to reallocate funds. And our local funder, which is the BNSS, Bath, North Somerset and South Gloucester Integrated Care Board, they found money to develop this training and deliver it. So this is currently done within Womankind and Missing Link. So they found 6 key strategy points. The first one being that they wanted all women's voices to be heard. So wherever women were from, they wanted them recognised and heard throughout the health and care system. And they wanted all women to have access to all services. And we know there are disparities there. Some women don't have their voices heard, and some women are treated very differently. You've probably all heard of the 5 Times More campaign, where through research, an Oxford company found that Black women in the UK were 5 times more likely to have trauma and death in neonatal care and maternity services. So the next point was that he wanted to address disparities in treatment and access to services. So they wanted to look at different health outcomes for things like autism and dementia. And you've probably seen that there's a lot of information now about autism in women and girls in the media and in publications and research. And I'll send a link to a really good program if you're interested, because it does impact the women you'll be interacting with. Many are undiagnosed, and many are wrongly diagnosed as having mental health conditions when in fact they have autism. it's a program on the iPlayer that I'll send a link to. It's really, really interesting. But one of the key findings from that was that 90% of the women interviewed, when a doctor was looking at changing the current diagnosis process from male to female, so to be based on the female mind and body, she found that 90% of the women she interviewed, that's 9 out of 10, had experienced domestic violence and or sexual violence, which is huge. And she said that's no coincidence. So women really do need early diagnosis to forearm themselves and understand their condition. The earlier, the better. They wanted, at number 4, better education and information for all, both providers and for the general public. And they wanted women's health to be addressed in the workplace. And I recently heard from a participant that they now have a menstruation to menopause policy, which I thought was an interesting title. Hopefully in your own organizations, you're developing, or you have policies and procedures in place to support staff, female staff, in the workplace. And the last point was that they wanted better research and for data to be held by sex. I don't know if you realize, but historically clinical trials were based on the male body. And if women did undergo clinical trials, then their data was amalgamated with male data. So there was no separate data stream, which is huge and has huge implications for dosage and diagnosis. So welcome, Romany. Oh, she's gone. Sorry, my mail. So the key points of the Women's Inequalities Training: it gives you an opportunity to discuss effective and ineffective practice. We don't talk about best practice because there's often a number of ways of being really effective with a client. You get to meet other practitioners. They could be volunteers with a charity, it could be psychiatrists, but they're all people working, supporting women with their mental health in Bristol and the surrounding area. So you get to see what people do in different jobs and in different organizations. You get to share learning and what has helped you, and you learn from others. And we have 2 case studies in the training. They're both based on real women that were supported within Womankind and Missing Link. And we look at the barriers that they and others have faced in accessing mental health care, and also once they're within mental health care, getting appropriate treatment. And it's really interesting looking at the barriers that they experience, and to see there are some that we can address and better support people with, but there are some that are system and wide and organizational. So we have very little say in supporting those. And then the last point is that this supports the development of the training through your feedback and your input in the session. So when you undertake the training, you get all the slides used, which you can use afterwards. They make sense, they're full sentences. And you underneath is a really comprehensive section of resources. Some of these have been provided by myself through research, and some have been provided by participants, showing things that help them, such as free training, great links on the web for information and documents to read, and also various support organizations. And one of the key things that has come up which may impact yourselves, is that huge waiting lists are really impacting people. The wait for either specialist care or generic care. I don't know of any organisation that doesn't have a really long waiting list, and some organisations are stopping waiting lists because of the huge number waiting. But there is one organisation that doesn't have waiting lists, and they're called Changes. I don't know if you've heard of them in Bristol. Changes. They have online and in-person meetings, a lot of them each week. And they also have intersectional groupings, such as a men's group, a woman's group, and an LGBTQ plus group. But they also have a women of colour group and a black men's group. And they are open to starting up more groups. These are peer-led. Clients can join for as long as they like. And there's no expected attendance each week, so it can suit people who can't attend things each week, and it has really supported some people. A lot of my clients in my position before found it really, really useful. And if you've got any ideas of things people can signpost to that don't have waiting lists, do let me know. That would be really useful. So the 3-hour training, we have guidelines, introductions, the need for the training, and a quiz. Then we look at the life cycle of a woman really comprehensively, and look at that against what can impact her mental health at the various stages she goes through. And this is using the life course model, which looks at social and economic impact as well as health. We then have case studies. The 2 case studies I spoke about, we look at them in depth, looking at their intersectionality and the barriers they may face, and looking at how we would help them, and perhaps even look to see if there's barriers that we would face as well and have to overcome. And then we look at common misconceptions. The training was developed and co-produced with service users and organisations in Bristol who support women with their mental health. And they gave us some of common misconceptions, which they often hear from the general public or other practitioners. We have a discussion around those, and all of those would be relevant to your work. We then look at the Bristol research data to see if that correlates with what you're seeing, the organisation telling us about the types of women they're seeing and any new trends. And then we have a reflective discussion about barriers, and we actually have it about the one that all service users felt was most important, and that was the one of communication. And they gave us some headings to discuss. So we look at visual communication, spoken communication, written communication, and non-verbal communication. And throughout the training, I also impart really effective things that other participants throughout the delivery, it's gone out to about 350 people now. So where they've disclosed really effective practice, I also am able to share that as well. And then we have questions, feedback, and a quick look at the resources, and all of that in 3 hours. So I don't know if you want to undertake this quiz. I just wondered if you knew how many women-only mental health support voluntary community sector organisations there are in Bristol, whether there are 4, 6, or 9. If you want to put it in the chat. Right. So it's actually the 6 or 4, because 2 of them are SafeLink and NextLink, and they're part of Missing Link, they're sister organisations. So the others are 125. Has everyone heard of 125 that supports street sex work? There's Womankind. Sorry, Sophie's just put in the chat that she was under the impression the course was 1 hour. Today it's only 1 hour. I'm looking at what this is an introduction to the training that we will deliver if you come on it, the Women's Inequalities Training. This is an introduction to it that I was asked to deliver by Jeannie. Does that explain it? Good. So the next question was approximately how many different languages and dialects are spoken in Bristol? Anyone else got any ideas? Oh, sorry. Evie's put the groups. So there's missing link, next link, missing. I'll show you a slide in a moment after this. There's missing link, next link, safe link. They're all sister organizations. There's womankind. There's 125. And you know, I've got menopausal brain fog for one moment. I've forgotten the last one, but it'll come up on the slide. So number 2 is actually 93. And that number came from when I was working with the Hate Crime Support Service. And this was from the police. And that has huge implications for translation and interpreting services within Bristol. And actually highlights that we are a very diverse, a complex, diverse city. We haven't had the money historically that there's only one city that has more diversity, and that is London. And we have not had the funding to support that integration and mix historically. So I think as a city, we've done really, really well. But we are one of 2 cities that has a hate crime support service. And if you've not heard of them, they do a really, really good job in supporting people, because hate crime is really insidious, and it can start off with just verbal abuse and often escalate to worse violence or indirect abuse. And it's always best to stop it as soon as it happens. And all the groups that work within hate crime work together to find a solution for that person. So the police can be involved, third party if that person doesn't want them involved, but to find a solution. When I worked with the Hate Crime Service, we found loads and loads of interesting solutions and support groups for people. So if you know of someone experiencing hate crime, do get them to get in touch, or get in touch on their behalf with the Hate Crime Support Service, because they have a lot of really good outcomes. And the last one was, can you name a local cultural support group for women? Perhaps you've signposted someone to one, or heard of them, or have them in your list of signposting resources. Yeah, Melanie's put SARI. SARI are the lead for the hate crime support work. They're actually not just for women, but they do support everyone. Women of colour, Nelsie, thank you. Yeah, there's quite a few. There's some underground that aren't constituted or have insurance and governance, so perhaps you're not able to signpost them. But these were the women's groups. Womankind, Missing Link with Next Link and Safe Link. The other one was Mothers for Mothers, and 125. They only support women. And then some of the groups I've got here are the Bangladeshi Bristol Women's Group, Black Mothers Matter, the Bristol Somali Women's Group, Dekbal Women's Group Project, and the Refugee Women of Bristol. If you can think of others, that would be great. The Chinese Community Wellbeing Society, yes, they were for women. They're now for all Chinese and Chinese descent people. What was the hate crimes group? Well, Bristol Hate Crime and Discrimination Support Service, and SARI, S-A-R-I, I believe it stands for Stand Against Racial Inequality. And they're based in Portland Square. So moving on, I did mention briefly at the beginning the other sessions that we've produced following input from people who've taken part of the Women's Inequalities training, the things they wanted to know more about, and the one that came top was autism in women and girls. So these are co-produced with service users from Womankind and Missing Link. There's a program of several themes. You can do one or all of them. And if you take part in the Women's Inequalities training, they're being offered to participants of the Women's Inequalities training first, and then going out to the wider community. Each session at the beginning has a recording of an expert speaker. It constitutes social learning, so you learn from others and also from past participants, which the host will input. And you develop learning through collective knowledge and experience. And you reflect and explore how to best address client needs and the barriers faced. And it's just been launched. The first one was last week. So, we're having to put more and more dates in because they're getting booked up so quickly. They're small groups, much like this one. So hopefully you've all heard of Missing Link, which is a mental health and housing service for women in Bristol, and it was established in 1982. It provides a range of housing and support to women that either have acute or long-term mental health needs. It's the largest provider of women-only services in Bristol. And it incorporates both NextLink and SafeLink. So NextLink operates local domestic abuse support services, and they have safe houses as well. And SafeLink supports victims of rape and sexual abuse through ISVAs and a support group. So NextLink supports women in Bristol and North Somerset and South Gloucester who've been impacted by domestic abuse. The support through community support worker or with an IDVA, an independent domestic violence advisor. Sorry, ISVA was independent sexual violence advisor. They have group work as well, the Freedom Programme. Sadly, Lydia can't be here to talk about that. She runs those in South Gloucester. And also another group called Breaking the Chains. And they offer training for professionals and volunteers who support women in recognising domestic abuse. And Womankind, has everyone heard of Womankind? So Womankind is run by women for women, and it helps women improve their mental health and well-being, and it's been running for 36 years. Womankind aims to reach the most vulnerable groups of women in the most deprived areas of Bristol and the surrounding area, and they offer free and also low-cost services. They use, like Missing Link, a trauma-informed approach, or that might be known as trauma-informed care. And they offer their services through helplines and web chats, one-to-one counselling, that's specialist counselling, through group therapy and befriending. And they also have training and supervision for volunteers and practitioners. And it's interesting to note that people can go from being a service user to a volunteer to a member of staff. They are supported to go through that pathway. They also run a Safer Women's project, which supports refugees and asylum seekers and trafficked women with interpreters. That's just been refunded for a further 6 years. They have general and high intensity counselling, a service for deaf and hard of hearing women with a BSL counsellor. BSL is British Sign Language using. And they have a specialist sexual violence counselling and young women's service that's just been refunded. And a befriending service with tailored support from volunteers. And that can be offered to women for up to a year. And they also offer group therapy for women with enduring health needs. Many women find that they need further help, not just the 12-week course that's often offered. And they can join the group therapy for up to a year as well. So, any questions? So I'm going to turn off the recording.